Good morning or good evening if you're in the Netherlands. I'm Dr. Lisa Finkelstein with Beyond Telehealth, and we have an exceptional guest today, Julio, and I'm going to have him introduce himself in a second. This is going to be about point of care ultrasound utilizing AI for maternal fetal health with a company called Delft Imaging. And Julio is going to explain a little bit more about this. But I was introduced to this idea and this company from a medical student, Mohammed Jamal, who is out of the University of Nairobi in Kenya. And he started an innovation group and introduced me to a bunch of people. It's taken a while for us to get here. So, Julio, tell us who you are and how you came about tell us a little bit about your journey and how you got here.
Okay, well, thank you very much for this invitation. Indeed, it took us a while to be here, but I'm really glad we finally made it. I'm Julio. I'm originally from Spain. My journey to be here, I come from a medical family. All my family are actual doctors, and but I could never be a doctor because blood it's really not my thing. So then, I studied computer science in Spain, in Madrid, and I always had that little thing of I want to do something related with healthcare, but also with technology. Technology, in the end, it's my passion. So then I started working as a backend engineer back in the time, like 10 years ago. And eventually I got to the moment that artificial intelligence was just starting. It was really something really interested for me, and I got interested into artificial intelligence. I came to the Netherlands 5 years ago. I did a master in artificial intelligence, and about a year ago, I started in this journey of BabyChecker within Delft Imaging as a deep learning lead currently, and we are developing algorithms for improving healthcare, maternal healthcare, and using point of care ultrasound.
Okay, so let's just talk a little bit of basics here for the people that are going to watch this. So, point of care ultrasound has always been an interest for me. So, I'm a urologist, and ultrasound has been a part of urologic practice for decades. And I've always felt that ultrasound was underutilized for many, many things. And now there are, you can do fellowships, you can do an emergency medicine residency and then do a fellowship on point of care ultrasound in the field or in the wilderness. And it really is can be a highly skilled ability to be able to know the anatomy, to read that ultrasound. Um, then what happened was the ultrasound, this big machine, came down to a handheld probe that the physicians could put in their pocket. And if they wanted to, they could then hook it up to their cell phone and utilize telemedicine, which is how I also got involved with this, to send those images to experts to look at the images in the field to say, yes, there's a pulmonary embolus. Yes, there's a kidney stone or something like that. So, explain how point of care ultrasound utilizing AI in the field of where you're talking about, like in Africa. How does this work, and what's the mission of the company to get it to work?
So you said it very well. I mean, ultrasound it's an incredible technology, and telemedicine, like it's also an incredible advance that we are doing in medicine. So, but the problem in developing countries is that it's not always easy to get this connection. Let's say like that, this network, this energy. There is energy outage in some places. So having like this telemedicine sometimes is complicated. However, imagine like in this case, for example, you have not only the opportunity to have the telemedicine, but also like an artificial intelligence that can bring you a result in a first instance that then can be corroborated by a medical expert afterwards. So then this improves a lot and speeds up the whole need or the whole interaction with the patient in places where it's really hard to get this interaction. Like in my company, Delft Imaging, we focus on developing medical applications. Like the main product, it's called CAT4TB. It's basically X-ray for detecting tuberculosis or for screening tuberculosis. And what we develop here, it's a backpack X-ray that you can bring anywhere and actually screen for tuberculosis. That's the main product of the company. And then BabyChecker, which is why we are here today, it's basically the same idea that you can make something that it's usually very big and complicated to bring to places like developing countries in Africa, like Sierra Leone, and make it something small that can be taken to anywhere and actually bring the value. So in this case, BabyChecker, it's focusing on its uses like the phone. It's a smartphone artificial intelligence ultrasound that you connect the probe to the smartphone. It can detect risky pregnancies using a blind ultrasound protocol. So this is an obstetric protocol. It's based on 6 sweeps that are 3 vertical and 3 horizontal. And the actual midwife that performs this in the primary health centers or in the community health centers, they don't actually see the images. This is another thing that you said that usually takes a lot to actually be able to understand anatomy and everything. With these 6 sweeps, you can collect enough information for a human expert that knows anatomy or for the artificial intelligence in this case to actually take an educated decision on what's actually happening. Therefore, for someone without training, they only need to know how to hold the probe actually. They can perform an ultrasound sweep that can be actually analyzed by artificial intelligence, provide them a quick result, then it will be verified by a medical expert in the Netherlands in this case. And this can bring, I mean, we are empowering the health workers in these community health centers to improve their work and make it more affordable for everyone as well.
Right. So it's lifting everybody up, right? It's allowing
Mm-hmm.
everybody to have to be involved and motivated. I don't know if my niece is watching, and she is newly pregnant, and it's interesting because she has from Amazon a
Mm-hmm.
portable Doppler that you can buy for $50, and there's like 10 of them where anybody, if they wanted to, could listen to the baby's heartbeat. And so, there's pros and cons to this. It's interesting when I teach the medical students in Philadelphia, I say to them, one of my slides is the handheld ultrasound. And I say to them, wouldn't it be cool if we could give the mom directions on just how to screen
Mm-hmm.
and look at their own health of their fetus? And the reaction is mixed. And these are young kids, and they're like, well, what if the mom has anxiety, and then they can't find the baby, or they can't listen to the heartbeat. And I've always been a physician that likes to empower my patients, because I think we don't give patients enough credit. We don't give people that are not necessarily highly trained enough credit to be able to do these things and want to do these things. So I think it's actually amazing that you guys are doing this. And tell us a little bit about how you're studying it. How are you validating it?
Mm-hmm. So for the studying and validation, I mean, we are currently collecting data in Africa, like it's where we are doing the most validation at the moment. But we also have collaboration with universities here in the Netherlands, in particular the Radboud University, where they are actually doing like comparative studies, like they run like a traditional ultrasound with the standard plane. They compare the accuracy of doctors with the portable ultrasound, the point of care ultrasound, and BabyChecker in this case. So then with these comparative studies, we can actually know like how is the BabyChecker actually working, how good artificial intelligence is working, and if it can actually be used in the medical field, or it still needs more validation and more training to do. Right now, like we have like 4 publications and one, I think, in review in an event that we had, like actually showing the results of the artificial intelligence that it's been presented for, that it's currently in use with BabyChecker. And with that as well, we are trying to reach other universities or other research um, points where we can also validate. Like we are trying to find partners that will help us with validating as well, like in other places, like not only in Africa, because it's interesting to also, I mean, currently the application it's trained with African data. Like because we are using it in Africa, so all the data that we managed to acquire was from Africa. We started in Ethiopia with a research study over there. That's where the first models were trained. And from there, we have been increasingly also expanding in different countries in Africa. We are not yet in a lot, but we are in Kenya, for example. We are in Sierra Leone. We are in Zambia. We are in Uganda. So like different places where we are actually like validating and collecting more data for improving the models and making sure that everything works as it should.
It's interesting, when it comes to health equity, the pandemic really shined a light on the inequities, and I can only speak to America, but it's been pretty eye-opening that, there's a lot of it doesn't matter if it's a wealthy country. We still have areas that are in the same boat of Sierra Leone and Zambia, where we have very rural areas. And I live in Wyoming, where there are very few uh, obstetricians, and even there's even less and less because of the laws that are being passed here in this country. And it's pretty scary. It's pretty scary for moms. And these are the types of innovations that I find so exciting, because again, it's empowering people so that they don't have to travel these long distances to get to providers, that they can, go to their own community clinic. They can go to a community healthcare worker, or a midwife that can be trained in utilizing this. Um, tell me a little bit more about the swipes that AI uses. How does that work? And how simple is it?
So basically, for training a midwife in Sierra Leone or in Kenya, where I was doing one of the trainings, like the 6-week protocol, it has been validated by several universities. I think the North Carolina was the one that actually implemented it, and from there it has like some changes out of it. Like basically, it's as simple as 6 sweeps. Like you have 6 sweeps over the belly, like 3 vertical, like and 3 horizontal. With that, it's very important that it's something that we mentioned. Like currently for the trainings that we do, we don't. I'm calling them trainings, but it's more coming, bringing them the probe and showing them how to handle it, because it's not really a training. We have a video tutorial within the application where we ask them to see and we also or to watch, and we also have in the every time like a new midwife is registered in the application, they have to watch this video tutorial. So we make sure that every new user actually watches it and knows how to use it. And with that, that shows that, for example, in the third, in the fourth sweep, it's very important to start very low, because if they start high, like not always the head will be captured. So these are some nuances, but a part of this, like the 6 sweeps, it's like something very easy that I remember when I did it the first time, and I was like, well, it's a little bit scary. You are scanning a pregnant woman suddenly. But I mean, it was surprisingly easy, and you don't really need to understand the anatomy. You don't really need to do anything. It's just like in a minute. Well, it's a little bit more than a minute, but you are done. Then you have the results in the phone, and the medical expert receives the results, and you get them back to the phone. And then you can verify that artificial intelligence, the medical expert, they both say, okay, you are safe, you have an okay pregnancy, and everything is good.
Right. Right. How about utilizing mixed reality with goggles for training? That's another area of interest with education, where you don't necessarily have to be there, or they don't have to watch video, but they can put on the virtual reality or mixed reality goggles. Have you utilized that for training?
We haven't utilized that for training. That's something that, I mean, in the end, that BabyChecker, it's quite a small team, let's say like that. So adding this, I mean, it's something really interesting. And virtual reality, it's something like, for example, my father, he is a ear, nose, throat doctor. Like, he uses it in Spain for like, what is it exactly? So it's, um, I don't remember the name. Well, it's for vestibular issues. So they use
Vertigo.
the
Vertigo.
vertigos. Yes, so for vertigos. So like, and he uses not artificial intelligence, but virtual reality to actually like simulate and treat patients. I know about its applications for training. I think it will be really nice, for example, for knowing exactly how, in which part of the belly they have to scan it. Like now we have a picture in the phone that shows it. I mean, in the end, it's a belly and it shows lines with the word they should actually scan. And that's for now, it's enough. But if we have like virtual reality, I think it has endless possibilities also for healthcare in general. Like it's something like with artificial intelligence, I think it's gonna be the future. Like definitely.
Right, and so that's one of the questions we can leave with, is the future of AI. And it's definitely not hype. It's real. It's here. And in our journals, for instance, in urology, over the past few months, every established journal is talking about different applications of AI, whether it's in pathology for renal cancer or prostate cancer, to MRIs and imaging and all kinds of uh, documentation is the one that we're looking forward to, where it can take doctors away from the computer, where we have to sit there and type our
Hmm.
notes. But yeah, what's your feeling on the future of AI in healthcare? That's a big question.
So I think, I mean, definitely artificial intelligence is here to stay. And especially since the last years, like from ChatGPT onwards, like it has been more in the mouth of everyone because before, I mean, artificial intelligence, it's also not new. Like it's been there for a while. I've been studying artificial intelligence since 2016. So, and there was already applications towards healthcare back in the time, but now everyone is talking about it and it's really on top of everyone. Um, I see a lot of regulations that I hope they won't stop the development of it because I know, like, for example, for data and everything, like, can be complicated. But I also see a lot of possibilities. And I think doctors and the users, the patient, shouldn't be afraid of using it. Like, I really think that, I mean, it's not going, in my opinion at least, artificial intelligence is not here to replace a doctor. It's here to help him using his time more effectively and being able to have a second opinion or a more informed decision on top of something. Because I mean, in the end, no one is perfect. Sometimes we are like artificial intelligence can help you take like these little nuances that you don't need to take care of them to focus more on the patient, focus more on other things. So I believe that definitely for what you said, like for the large language like LLMs, like they are gonna be there and they are gonna be part of it, like to be able to write the history or documentation, like detecting cancer, like safer pregnancies. Like, it's infinite possibilities, and I'm really excited to see what we have ahead. Like, I think it's a really interesting journey, and I'm also happy to be part of it because it's really nice to, like, for me, the first time I was in Kenya and I saw the artificial intelligence models developed, like being used and everything, like I was like, wow, like this is something like we have developed and suddenly it's here and it's telling someone if they have a, like, it's also a lot of responsibility, but like it's the future. Like, in my opinion, it's here to help.
I like the term human in the loop. It's artificial intelligence has to have humans in the loop in order for it to be the best that it can be. And when I teach the medical students, I tell them, don't be afraid, because these are our leaders. You are going to be leading the way. And if we don't play a part and be involved, that's where things could, go sideways, because we do really know what's best for our patients. Well, Julio, let's leave it at this, and stay on for a second. I'm going to end the recording, but thank you for joining from the Netherlands and teaching us about BabyChecker.
It
See
was my
ya.
pleasure. Thank you very much. Bye bye.
Thanks.